Good morning. Welcome back to the Broadcast Retirement Network. This is BRN AM for Tuesday, December 12th, 2023. And our top story today, how does aging affect your eyes? And joining me now to discuss this and a lot more, Dr. Alan Schlussel. Alan, it's so great to see you. Thanks so much for joining us on the program this morning.
Thank you for having me.
Yeah, I always like talking about vision, obviously one of our an important sense. And Alan, let's start with our aging eyes. And I'm a middle-aged male, 51 years old. I've noticed my eyes have changed over time, but from the practitioner's perspective, how do our eyes change as we age?
Primarily, the main change that we notice is people have trouble reading up close with their glasses on if they're nearsighted or if they've had excellent vision their whole life. They start to have to pull reading material further out, and they start to need to wear reading glasses when they read small print. That's the main thing that most commonly we hear, but there's other effects of aging that it can go into.
Yeah, let's talk about that because, I'm holding up my reading glasses and look, I wear contact lenses. I've worn corrective lenses since I was about 3. So but I wear contacts. Reading glasses are very helpful. But Alan, there are ailments and things that people can develop over time just as they age.
Absolutely. I would say the most common one that we hear from patients and see is people, I would say mid-60s to mid-70s, is the onset of cataracts. Cataracts are a mild clouding of the lens of the eye, and it affects glare driving at night. And when it gets to a certain level and the patient's uncomfortable, they can be easily removed. And in some cases, the patients has a benefit over what they had before, because with the implants, the intraocular lenses, we can correct people's vision to 20/20 without correction, without glasses. Like some people might wear a very thick correction before, they may not need anything afterwards. That's the most common in people over 60. As far as, I would say, younger patients in their 40s and 50s, dry eye is a very common thing amongst contact wearers, and even just people that we all sit at screens. Zooms are obviously so much more common now since COVID. And when you're staring at something and not blinking, the onset of dry eyes, or specifically we call meibomian gland dysfunction, is very common and very prevalent.
Alan, just to kind of build off of that, what about allergies? Look, our environments change over time. Our bodies have changed over time. I was talking to someone, she had developed allergies later in life that she never had early in life. That possibly, those allergies could lead to some of the things you're talking about, dry eye, irritation, etc.
Oh, absolutely. I mean, I think another onset of COVID is people have moved around the country. Maybe they're moving out of the cities and into the suburbs where they're exposed to trees and grasses that they didn't get in the cities where they're living, especially in the New York area. So they're exposed to things they never were exposed to, and they develop a lot of allergies around the eyes, skin, and it causes them to get redness, rubbing. But good thing is there's a lot of good medications to help for that, preventative, over-the-counter, prescription. And even with contact wearers, we switch a lot of our patients from monthly 2-week lenses to daily lenses, so there's less concentration of the pollen that gets in the lens. So just replacing them every day seems to help that a lot.
Alan, what about the proverbial floaters and flashers? I've heard people refer to this. First, what are they and how common is it for people that are aging?
Very common. That's another condition that we hear from and see with many patients over 50. What it is there's a jelly that's in the back part of the eye that keeps the eye from getting injury. When we're younger, if you poked your eye, you didn't have that jelly or jello, it would cause a detachment of the retina. So that jelly or jello that fills the back of the eye is called vitreous, there's little fibrils within the vitreous, and as we age, that jello seems to shrink and become less jello-like and more liquid-like, and it just flows around and pulls away from the back of the eye. When it pulls away, it leaves a little bit of a ring or a little like light floater, and we call that a vitreous detachment. So we have to carefully monitor that, because patients will always come in right away, look up on Google and think it's a detached retina, but in fact,
Yeah.
it's actually a detached vitreous. And as long as it doesn't pull on the retina, it just naturally detaches, and there's a little kind of a line or a filament that's in their vision, and they just have to learn to ignore it. Over time, gravity brings it below level of their vision, and they don't notice it as much. But when it first comes up, they can see it up around their eyesight line, and then they tend to notice it when they're reading. But as time goes on, it tends to go below their line of sight, so they don't notice it.
Yeah, I was laughing a little bit, not at you, but you mentioned Dr. Google. I feel like there are a lot of people that access Dr. Google, right? I mean, is that something that, as an aside, not related to aging, is that something that you have to educate patients about? Because,
Well,
you know,
I think it's a good thing in some ways, because in the case of floaters, it's all over Google that you should go see a doctor and get advice and don't wait. So that is a good thing, because they're getting the right care. I think where it gets to be a problem is when patients come in with all sorts of complicated cases of dry eye or prescriptions or contact lenses or medications, and they kind of think they've gotten the knowledge from Google and they're a doctor, and they tend to ask you so many questions like, why didn't you use that? Why didn't you prescribe this? And that gets annoying, because, you know, you're a doctor, you know, I have the experience. I think Google's good for explanations, but not to treat yourself or question the doctor.
Yeah. Last question before we go to a commercial break. And that begs my question, artificial intelligence, and how has that found its way into into the business of being an eye doctor or being an optometrist or an ophthalmologist? Has that technology crept into your world?
Not as of yet directly. I think it will. I've read some articles that AI will help with diagnosis of diabetes in the eye. So there'll be availability of people going to a screening to their general practitioner, have a photo of the retina like they do in their eye doctor. And AI can analyze whether it looks suspicious for diabetic retinopathy, bleeding, blood vessel changes, and that would alert the primary doctor to send them to an ophthalmologist or an optometrist to have a thorough retinal exam. And then if there's a problem, have it treated with laser treatments or different types of injections done for diabetes.
Yeah, it's absolutely amazing. All these technologies, everything you were talking about, including now artificial intelligence, kind of creeping their way into the medical field. Alan, I need to take a very quick break. When we come back, we'll talk about how you can prevent and treat some of these eye ailments we were talking about. You're going to want to stay tuned right here on BRN AM. Imagine a new television network that will make you richer, healthier, and in control of your financial future. This network is for the policewoman in Nashville, Tennessee, the baker in Dubuque, Iowa, the teacher in Lexington, Kentucky. We want to make the idea of savings and retirement culturally relevant. But what do you see as a defining issue of the midterms? Especially for the smaller businesses. I mean, they are the lifeblood of the American economy. Featuring exclusive interviews, current affairs, and docuseries. 33 years old, you retired early.
The philosophy is money only matters if it helps you live a life that you love.
But you got to start thinking about retirement as soon as you get in.
The Broadcast Retirement Network will drive very high engagement with premium partnerships. So this isn't retirement and savings for your parents or grandparents. This is for all Americans. And we're going to change the way you think about money. Welcome to the next frontier of retirement and savings. This is BRN, the Broadcast Retirement Network. Alan, thanks so much for staying with us. Really appreciate you hanging around for segment number 2 this morning.
Sure, my pleasure.
And I feel like after talking to you, my vision has gotten clearer. I don't know if that's a placebo effect or maybe you just have some amazing powers. Alan, let's talk about preventing these age-related eye problems. And I have to think, you're a practitioner, the routine visits to the eye care professional are where you're going to catch the things like the cataracts, the glaucoma, the floaters, and other issues at the dry eye.
Yes, absolutely. I think it's imperative that people come for routine exams. I think most people do, especially if they have good vision and health coverage. I think where it falls is the patient that has great vision from the pediatrician till when they're 40 and they kind of don't think they need to see anybody, and they'll just go to the pharmacy and buy a pair of reading glasses. And maybe that goes on for another 15 years before maybe the reading glasses in the pharmacy aren't strong enough, and they'll then finally get to a doctor. And in rare cases, you pick up glaucoma, you pick up diabetes, blood pressure issues that we see in the eye. And those are the ones that are unfortunate, because if you wait till that time to treat it, you've lost a lot of ground on addressing the serious nature of these conditions. But
insurance, I'm an individual employer, so I buy my own insurance. It's pretty cost effective. It's not too terribly expensive, relative to regular healthcare. Go ahead.
Most routine health plans include a routine eye exam, and some employers offer employees to buy a specific vision plan that covers glasses every year and contacts. So yeah, it's relatively inexpensive to have that insurance.
And for my own edification, I don't know this, but does Medicare or Medicaid, do they cover an eye visit once a year for a senior?
They cover routine exams but not specifically the part of the exam where we check their glasses, but a lot of the Medigap plans and the HMO benefit plans do cover routine eye exams. So they'll usually align with an insurer that covers that. So often Medicare recipients do have that coverage unless they have the plain Medicare and supplement where it doesn't cover eyewear or glasses.
Right. Alan, so when they come into the practice, I want to just talk a little bit about, just familiarize people with some of the, I was going to say experiments, but they're not experiments. Some of the tests that you will do. And I think a lot of people are familiar with the over the eye, read the chart, but let's talk about some of the technology. You can look into the person's eye, deep into the eye. You can see their lens. You can see whether or not it's healthy. So there's a lot of things that you do as a practitioner to validate, and you have all this technology available to you.
Oh yeah, and certainly throughout my career, we've had that technology. I think the biggest game changer for my practice, probably over the last 20 years, is something called OptoMap. It's a laser camera that takes a wide angle peripheral shot of the entire retina, and we can get different views on our screen, and we can see all areas of the retina, including the main section, the macula, the optic nerve, and we can do it without putting the dilating drops in, so that patients don't have to go back to work blurry or have trouble driving afterwards. And it's been a game changer because you can pick up things, you have a record of things you might be monitoring. Occasionally we'll see a freckle in the retina. We take a picture, we encircle it with a certain device to say the size, and we can monitor change over time. And that's been a real help for patients that have these things. And I think going back to prevention, what we do, one of the things I should point out with, glaucoma is people don't have symptoms of glaucoma. You could have a pressure of 30, which is considered high, and have excellent vision until you get to the moderate to severe end stages of glaucoma. And you have no feeling, no symptoms. So that's the one thing that can be a silent problem with people's vision. They lose their vision from the periphery, the side vision, and they don't know anything until they've seen a doctor. So that's the one thing that routine care can help. And I think the same thing goes with dry eye, is that a lot of younger patients wearing contacts don't have the traditional symptoms of dry eye. So they'll rub their eyes, they wear contacts all day, and by the time they take them out, their eyes don't really feel that uncomfortable when they go to bed. But we can see signs under the microscope. We can see that the glands along the eyelids and the tear film is not causing good health of the cornea. And they can develop scratches, corneal abrasions, problems with the eyelid margins, and that needs to be treated or preventatively treated in advance before it causes problems.
Yeah, I guess I just don't understand. I mean, the prevention steps, you're not in your office for hours. You come in, what is it, a 30 to 45-minute appointment, generally speaking, maybe a little bit more if you have some additional tests, but it's really not that invasive. And a lot of doctors now have hours on Saturdays. I'm not saying you do, but some doctors have hours on Saturdays.
Most of my colleagues do. We have Saturday hours. We have a late afternoon, evening hours. No, I don't think the time on the patient is the problem. I think it's just getting out of their lifestyle. Everyone's busy. People have agendas. They have kids when they're younger and they just don't get a chance. But I think most modern offices like ours have, reminder systems, text systems to remind people to come in. And especially with the contact wearers, they can't renew their prescription until they have an annual exam. Yep. The glasses people, that's the hindrance, because they could just buy glasses online and they probably have very limited steps to prevent them from, going year after year without an eye exam.
Yeah.
But some states actually require an eye exam to renew their license. I know in New York State, people have to have their license renewed and have an eye exam every 3 years whenever you renew your license.
Yeah, no, really good point. Again, I think you can make time just like you can for the dentist, the doctor, and any other medical need that you have. You only get one body, you only get one set of eyes, so far as we know. Alan, we're going to have to leave it there. Great to see you, literally, and great to talk to you. Thanks so much for joining us, and we look forward to having you back on the program again very soon.
My pleasure. I bet I can offer some insight. Thank you.
That wraps up this episode of BRNAM. Have a topic of interest, someone you think we should talk to, drop us a line. And don't forget, for all the latest curated news and lifestyle, wellness, finance, tech, so much more, all in one place, check out today's edition of our daily newsletter, The Morning Pulse. Want to search our archives, check out our latest content? Then visit our website. We're back again tomorrow with another edition of BRNAM with a very special guest. Until then, I'm Jeff Snyder. Stay safe. Keep on saving. Don't forget, roll with the changes.
But if you're tired of the same old...
Now is your opportunity to co-create content around any topic on the first lifestyle and wellness network. Reach a global audience through our platform and co-own exclusive branded content. All of our programs are available on demand and also as audio-only podcasts, so you can take us on the go. Broadcast Retirement Network, available anytime, anywhere, and on any device.